palliative care in the era of COVID. I tell you, palliative care is a topic that is really important, but because of this COVID and pandemic that we're in, there's a heightened need for us to have robust discussions about, what it is that our loved ones, what their values, goals, and preferences are when they're faced with a serious illness. And so one of the things I want to do is, number one, let me just introduce myself and some of the team members that are here. But then we thought it would be a good idea really to try to gather some insight into where the community is with regard to advanced care planning and palliative care, especially in this pandemic. I really want to just give you an opportunity to tell me what your big takeaway was, what stood out to you.
It was really kind of sad because people were really dying alone. They didn't have anyone that could be there to help them or to explain what was going on. Everything happened so quickly and so fast. And I think that most of the people had never had the time to discuss because this illness came upon so quickly. So, I think now that the illness is out there, now people can begin to talk about this. What would you do?
Hi, everyone. My name is Morgan. I'm a senior nursing major at Howard University. So we study palliative care at the basics, and it's basically making sure that people are comfortable on their way out. So that's the main focus of palliative care. But with COVID, everything happened so quickly. And we don't necessarily talk about the emotional aspects of planning for our loved ones passing on. And that's a very difficult process. It's not always black and white. I know Bailey was talking about how she knew that her mother didn't want to be on a ventilator for the rest of her life. She was talking about how her mother didn't want certain end of life measures, which is basic palliative care planning. But it's when it comes to COVID, we don't necessarily equip ourselves as readily because it can happen to literally anyone and moves very progressively. So I thought it was very interesting to see those kinds of effects, because I know when it comes to end of life planning, when people start getting in their 60s, 70s, 80s, we start to plan more naturally, okay, this is something that may come over us. But as we see, COVID really affects anyone, and it's how do we plan for that? How do we get our ducks in a row? Do we know what our loved ones like? And do we know what our loved ones would prefer when their end of life care comes about? So I thought it shined a light on something that definitely kind of needs to be talked about. It's do your loved ones want to be on a ventilator if there's no sign of brain activity, that kind of thing. So I thought it was definitely a very interesting episode.
Good.
What the show did for me, COVID wasn't the driver for me because I'm dealing with my dad having cancer and, being in a good place with it right now. My sister had it. She's clearly cured. But, so these are the kind of conversations that come up as family. And what I took away from the scene was, yes, COVID was the glaring piece in that particular piece, but because I've dealt with my mother-in-law, my father, and my sister, it's more real to me. So it's more relevant to me in different ways. Mm-hmm. So one of the things that I took away from the particular scene was that she seemed to be very frustrated, sitting on the bench, not knowing what to do, not knowing, if she was doing the right thing. And her coworker said to her, "You're doing what palliative care is. You're doing what she wanted you to do." So, my takeaway was that she had basically made plans to do what her mother wanted to do. And I didn't know if she was questioning her mother's choices, but I thought that she had made the decision to do what her mother wanted to do. And she was kind of wrestling with that, with it after that.
How to effectively deal with a family member who is dying. And because she said that, how do I tell my father that she's not going to make it through the night, and I think that sometimes, and now with COVID, we're finding that there are a lot of healthcare workers, nurses, doctors, respiratory therapists, they're finding themselves in this same situation, and there's a lot of emotional distress. And it was when she was actually sitting on the bench and talking about it, she had a lot of grief. And some of that is what we're seeing now in healthcare workers. They're having a lot of grief, a lot of moral distress. So I think this is such a timely topic.
What we saw from every single like doctor who was working is like they just had a high level of agitation and just kind of despair about a lot of the patients that they were facing. It was like people regretting to go into work because they were just like, I'm just going to keep seeing all of this death. It's like they couldn't even get out of bed, or they didn't want to see their family members as patients and stuff like that. So it's just like the healthcare workers are also carrying this huge burden of their own grief that they see every day. And it's like, of course, you never get used to seeing loss. You never get desensitized to that. I don't care how many patients die in front of you. It's like, it's still a heavy burden. And then with adding COVID to it, it's like you're seeing that rate quadrupled, tripled, all of that in a matter of like days or minutes when you're working in the hospital. So you could just see like, there was so much despair with every single healthcare professional that they interacted with.
Being in the healthcare profession myself, I work with hospice as a hospice nurse. But what do you do? The Bailey, she knew her mother's wishes, that her mother didn't want to be on respirator, whatever. But how about when her mother has Alzheimer, but she had the lucid moment where her mother said, I want to live. I want to go home. Am I being selfish? Am I doing what my mother really wants? So being a healthcare worker, working in hospice, I've seen family members where the patient had the advanced directives, the healthcare surrogate, the DNR, all of that. But then there'll come a moment when they're close to the end, they might like say, I want to live. Should I really honor their wishes? Do they know what they're talking about? Are they confused? So what I took away from that show was, you know what do you do as a family member if you know they have the do not resuscitate, they have the living will, they have all of this advanced planning in place, but all of a sudden they say, I don't want to do this. That's another dilemma too when you're explaining advanced planning with a person. You know, you just have to look at different scenarios that may occur and just tell them, hey, you know, what do we do in this instance? But that really stuck with me because she knew her mother has Alzheimer, but her mother just had that lucid moment where she was like, I want to go home.
So that happened, you know, when my father was dying, he had the DNR, and my mother said she was standing there and he was losing life, and it took everything in her not to say stop. Exactly. So the question is, does she have the power at that point? Because when he did all his paperwork, he was very clear, and he said, do not resuscitate, and they put it over his bed. And she was there when he was leaving. And she tells it till this day that it took everything in her. You know, you see the eyes rolling back in their head, and you know they're losing life. You know, it took everything in her not to stop it. So the question, did she have the ability to do that? Lucid. As a matter of fact, when we checked him into the emergency room, he signed off at that time, and he was of his mind.
So the reality is that when you have an advanced care plan, all that is kind of laid out in advance, so that when you do have an emergency situation like that, you already know what the patient's wishes, goals, and preferences are. And so it relieves you of the decision-making burden, you know, in a time of emergency, because that's what your dad wants. He wants to, you know, pass peacefully. And, you know, the whole process is getting us to the point where we're okay, that is their life and it's their decision. But when you don't have it documented, when you don't really have those robust conversations and understanding about it, then it really does fall on the caregiver to try to do everything. And in that case, we always, reach for the Hail Mary to try to preserve life. And sometimes that's not what the patient wants.
You have to bring them back to reality. You know, you have to talk to them, because they do. When you're in that situation, they get very emotional. And sometimes the family member may be standing right next to you and their loved one is dying. Right. And then they think, no, I want you to do, but then you have to talk to them. Okay, let's just rethink this. What
So
did your
now,
father want?
so now you're having two conversations because, like I said, dad said no, but mommy said it took everything in her not to stop it. So that's what I mean. Are you having conversations with both at that time?
I want to chime in. It's a tricky situation when it comes to that, because it's been where, even though you have the DNR, but if you have like this overly aggressive family member that's saying stop, 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 legally, it's like you have to stop, or else there's then the suit,
Oh,
because they'll
wow.
say, oh yeah, people will lose their, well, I'm not going to say lose their mind, but they may, it may be at the point where, even though the person is going to die or dies, they could say, I told them to stop. They could have lived a little longer, and if they find a lawyer who will take that case up, yeah, you may have a few problems. Yeah. So you
Yeah.
really have to have spoken with the family,
That's what I mean. Have both,
and really
do a
gotten them on
conversation.
board. Get to that point where, even though they're dying, you want to stop it, you got to go ahead and honor their wishes.
So there's something called a healthcare surrogate, that when you're putting together your advance directive or your will, that you designate one person to make decisions for you. And so I would say technically that is the person that could make changes. A family member has influence, but if they're not the healthcare surrogate, then they don't have the legal right to stop that process.
You're in a hospital setting or nursing home setting, they have sort of ethics committees, or committees that they can sort of put together to kind of deal with the ethical question. Because as Peggy said, you have that legal ramification, and in the back of everybody's mind, they don't want to be sued. So sometimes we have to bring in the chaplain or the spiritual leader along with the ethics committee to kind of really answer the question, what is the person's wishes? And if there's a living will, we kind of start there, and then we also recognize all of the emotions that are around end of life. And we may have to have the social worker, the licensed healthcare social worker come in, or counselor, to begin sort of helping that person through the bereavement process. Because and I've seen this often with family members that are out of state. They had nothing to do. Maybe there was a bad relationship, and then in the end they come in and they want everything done. And so I always say that it's always better to err on the side of doing nothing or stopping before rushing to the end, because you can't reverse it, but you can maybe slow it down, answer the questions, and get everybody on the same page.